The HIV/AIDS epidemic is a serious threat to the Latino community. According to the CDC, by 2006, Latinos accounted for 19% of new AIDS diagnoses. In 2005, HIV/AIDS was the fourth leading cause of death among Latino men and women aged 35 to 44.
The numbers have continuously gone up amongst our youth, especially African American and Latino youth. So, as I said, the numbers have gone up, and what we have to do is continue to educate the youth, tabling at summer events, handing out condoms, doing condom demonstrations. Those things are a necessity in our community.
Ja Ayov Serrano was one of those cases. He got diagnosed in 2005 when he was only 17 years old.
I contracted HIV 15 going to 16, but I didn't test positive until 17, which was about 2005. And it was a hard time for me because, you know what, dealing with home issues, dealing with school, dealing with life issues in general, it was hard for me to come to terms. And I kept it secretive because my family, heterosexual, Latino, Catholic driven. So for me to say that, you know, I'm gay and that I'm HIV positive, which is one of the stigmas out there.
He's now using his experience to help others because he feels education is the key.
And I felt like, you know what, there's lack of education within the schools, and parents barely want to talk about sexuality and sex and try to protect themselves. There is a cure out there, and the cure is, you know, demolishing the ignorance and the stigma out there, and to allow people to know that it's manageable and we're going to live a long time, and it doesn't matter how you got it.
Antonieta Etienne agrees with this statement. She also feels that the biggest problem faced by the Latino community is the stigma that surrounds the disease.
As a Afro-Caribbean Latina, we are still not getting tested. Stigma, discrimination within our families is still very difficult. And also, you know, a lot of Latinas we're very religiously connected. So it's hard for us to come out and tell our families what's going on. And our families are so scared of the virus, and they're not educated, so it's hard for us.
But as Doreen Bermudez explains, the problem goes beyond our youth. Although they tend to be left out of the discussion, the elderly is also being affected and are at great risk of getting infected.
We have to understand that traditionally, seniors are not included, and we make assumptions that seniors are not sexually active. They have become underserved populations, and that is not the norm, and that is not the reality that we are facing in our communities. Our seniors are sexually active.